Well, today marks World Lymphoma Day. In Australia, 4 Australians will die of the disease every day, and it's the most common cancer affecting teenagers.
Despite this, some still misunderstand lymphoma, and many believe it is the so-called good cancer. To help us shed more light on this disease, we're joined by Donna Gairns, National Lymphoma Care Nurse Manager. Thanks for coming in. It's a complicated cancer. There are so many aspects to it. When somebody says, what is lymphoma, what's your answer?
Well, lymphoma is a disease that revolves around the lymphatic system. Our lymphatic system is all through our body, like our vascular system, and it carries lots of nutrients, filters waste and fluids through our system. And throughout the vessels, there's also lymph nodes. And these lymph nodes store specialist blood cells, white blood cells, which are called B-cell lymphocytes, and they're really responsible for our immune system with producing antibodies. And most lymphomas are derived from the B cells. And there's also T-cell lymphocytes, and these are really quite responsible for roaming around our body, recognising our own blood cell or our own cells, full stop, whether affected by infections or viruses, or even slightly abnormal, so basically protecting ourselves from cancer. So when something goes wrong with these cells, they grow uncontrollably, don't do the job that they're supposed to do, and therefore they start to produce tumours or lumps, usually in the lymph nodes, and they can occur anywhere around the body, and therefore weakening our immune system if it's not treated.
How common is lymphoma in Australia?
Lymphoma is the 6th most common cancer in both adult men and women. It's the 3rd most common cancer in paediatric age group, and it's also the most common cancer in that 15 to 29-year-old age group. There's over 80 different subtypes of lymphoma, so effectively 80 different diseases that are under the whole umbrella of lymphoma.
Just incredible that it's the first in young people, the highest rate. Is there a theory behind why that is?
There's no real theory. It's just certain subtypes are more common in that age group. I guess in that age group there's a lot of physical development, and we don't really know the reason why and what causes most lymphomas actually, but it just happens to be that lymphoma in that age group.
So why is it called sometimes the good cancer?
I think a few theories. I think it's more that unlike, say, breast cancer or bowel cancer, cancer's not really in the name of lymphoma. So it doesn't sound as cancery, I suppose. And therefore a lot of people don't understand, because there are so many different subtypes of lymphoma, that they don't really understand that it is actually a cancer, because a lot of patients do report that. A lot of people say, oh, it's not really cancer, you just need chemotherapy and you'll be fine. And it's not the case at all. A lot of patients aren't curable in this disease. There are some very aggressive cancers that can be curable with chemotherapy, but there's a lot that can't be cured and very difficult to treat. And there's some cancers that are very slow growing and incurable, where people can live with them for many years, having treatment on and off over many years as well.
I'm sure those comments are made with the best of intentions, but it isn't really what you want to hear if you've just been diagnosed with any form of cancer, that it's the good cancer. What helped is that, really, to hear that? It's
not real. I guess, especially when coming from a health professional, it's something I've been teaching health professionals probably not to say that. But it's coming with good intentions, I think, to say, especially the ones that can be cured. I guess they're saying that, oh, you're okay, you've got the good cancer, you can be cured. But that's not what someone who's fighting for their life needs to hear. And even the subtypes that do have a higher cure rate, there's still some patients who aren't cured for this disease, and it doesn't help them, obviously, of course. And the treatment to be able to get to a cure is quite severe and can really be life-impacting for lifetime.
So what should you say?
Just be more understanding, I guess, and just to acknowledge that they do have a cancer, and even though they might not have lost some treatments, they don't lose their hair and they might look physically well, just to be mindful for people to be bit more considerate about that, that they might not be feeling well underneath, but just being there to support them. And
you're a lymphoma care nurse. I mean, it's your job to be there for people, to help explain. What sort of support is there, particularly when you're dealing with young people and the families that are affected by this? What sort of support is there in Australia for them?
At Lymphoma Australia, we do have a national support line, and you can access a lymphoma care nurse such as myself, regardless of where you live around Australia. We have also our private Facebook group, Lymphoma Down Under, which has about 1,600 members from all around Australia, and it's a really good community support where they can talk to each other and share problems. And this topic did come up about the good cancer quite a while ago in that group, and it sparked a very big conversation. So it's a really good support for them. We have resources on our website, lymphoma.org.au, that patients can access, and we do also refer patients to other organisations that be able to support, such as the Cancer Council, Leukaemia Foundation, Red Kite Canteen, are all really great organisations to help support lymphoma patients.
Is there enough awareness around lymphoma?
Definitely not, no. I think because we're maybe the 6th most common, but overall probably the 10th most common in Australia, we sort of get fallen down the back a little bit behind, such as breast cancer and bowel cancer are a little bit more common.
Well, a perfect question after that is, what are the symptoms? I mean, I guess many people would not know what the symptoms are of a lymphoma.
Yeah, and they can be quite vague. Some patients might not have any symptoms. They may, some of the low-grade cancers, they might have be growing along for years before they actually get any symptoms or get diagnosed accidentally through another scan for something else. But the main symptoms that most people do find, they have lymph nodes that are growing in size and hard, and they can be anywhere. The most common, I guess, is the neck area. If you feel like you've got a cold, they don't go away. Also night sweats, weight loss, increased waist loss without trying, and fevers, itchiness, and general fatigue. So they're very vague symptoms sometimes, and especially after the winter period, people think they might have had a virus or a cold, in which they go backwards and forwards from the doctor, and when those symptoms don't go away, soon as probably when the peak times come after the winter period and people's lymph nodes are still swollen. So do get them checked out. The only way we can actually diagnose a lymphoma is through a tissue biopsy. It isn't really shown on blood tests or anything like that. It might affect other cells down the track. But yeah, it's very hard. So no early detection tests are there for patients.
Keep an eye out. All right, Donna, thanks very much for coming in this morning.
Thanks for having me.
Good to see you.